Well, in all age groups, there's so much wrong about what we're feeding children, teenagers, young adults, old adults, and what they might call the elderly. It's just so backwards. It's so sickening. It's so fattening. And one statement I would make is that pretty much everybody is ill that eats the American diet, and you can see it. I mean, good grief, when 80% of the people are declared to be overweight and or obese, that's a pretty high percentage of the population. You're not even looking at problems that may be a little bit hidden, like their blood pressure, their blood sugar, their cholesterol, their triglycerides, their kidney function, their liver function, to see if there's been impacts on various organs like fatty infiltration of the liver, like kidney damage and loss of kidney function. These things are a consequence of eating an unhealthy diet. The diet begins with the female breast. And there's really only one ideal food for an infant, and that's the baby's mother's milk. They call these substitute formulas. They're really not substitutes. I mean, the kid will live, but not in good health on anything but mother's milk. And we must make sure that mother is eating a good diet, because whatever she eats ends up in her breast milk. The medications she takes, the environmental poisons that she consumes end up in her breast milk. Let me give you a couple of examples. The Environmental Defense Fund, they did a study back in the early 1970s where they looked at the breast milk of 1,400 women in 48 states, and they declared human breast milk an environmental hazard because of the pollutants. In Alaska today, I realized that the diet of the people that live in that part of the world is very high in junk food, but very high in animal products. I mean, that's a natural diet of the Inuit Eskimo. And these days, suggestions are made that we should bury any unused breast milk in toxic waste dumps. So you got to be careful what you eat. And when the mother eats low on the food chain, which is what our diet is, she takes in the fewest amount of environmental chemicals she can possibly take in, except for maybe adding organic to her list of shopping. So we start with mother's food, and then we go on directly to baby's food, which is the breast milk, which is always ideal. And then as a child, what happens at about 6 months of age, children develop teeth and hands to reach out and grab. And at that point, whatever is sitting in front of mother or in her hand, the child's going to grab a hold and eat. It's just natural. And so solid food becomes introduced at about 6 months of age, naturally. And it becomes progressively a more important part of the diet over the next 2 to 3 years. And breast milk becomes less an important part of the diet over the next 2 to 3 years. So you got this crossover here where, you're going to do a few feedings in a 2 and 3 year old, or you're going to do many, many feedings in a newborn. Anyway, you transition to solid food. And because the infant is still in need of a considerable amount of fat in the diet, the child below the age of 2 to 3 years should have some extra fat in the diet, just like human breast milk. Human breast milk is about 50% fat. In this young child's diet, I see room. Child should not be on a low-fat diet before the age of 2. I see some room for adding things like nut butters, avocados, maybe some nut milk or soy milk in the diet to add some extra fats. And then you get to a point where the children are starting to become fat themselves. And the fat you eat is the fat you wear. So you're dealing with a 3-year-old who's already obese. What do? You take note of what I just told you, and you get the fat out of the child's diet, and that cures the obesity. So it depends upon how the child responds, what the family is, etc., what maneuvers you might want to make, but it always needs to be, once you start out introducing solid food, it needs to be a starch-based diet. And you might manipulate the diet a little bit by adding more fat in the youth, so they can develop a good neurologic system. And later on, you may make some manipulations that help you lose weight faster, or maybe even gain some weight. I mean, there are those of us who need to gain a little extra weight, and you can make some changes in the diet along the way. And I think another important thing to consider is, what do you like to eat? We just talked about what the nutritional components are, but depending upon what you learned is probably what you like to eat. I was raised in the Midwest, and we ate a lot of potatoes, and I still find potatoes my comfort food. When I moved to Hawaii, we learned to eat rice. I have a great appreciation for rice. So if your family happens to be from Mexico or Central America, maybe corn, maybe beans, maybe squash. These were things that you learned as a child from grandma and grandpa's cooking. Maybe if your heritage comes from the Far East, Vietnam, Thailand, China, Japan. Maybe the starch you like, I bet it is rice. So make sure you make preferences based upon what you have already learned to enjoy. No sense in making any radical changes here. let's pick foods you like to start out with and you will continue with. And there are many starches out there, and the way you can flavor them to make them enjoyable is just like Grandma used to do. You want to make it taste familiar.